Hello, Kinesiology 3030. Welcome to our review lecture for the Osteology chapter. So we talked about this in lecture. We've talked about it in lab. Um, this is just going to be a kind of fast go-through review, just in case you missed anything. Maybe you weren't able to attend a lecture or you just want some extra review. This is a great resource for you. Okay, so let's get started. So we're starting with our skeletal system. This is going to be the focus of most of this section. We'll get into connective tissue a little bit later. But we have these bones that create structure for us. They protect our vital organs. They support our soft tissue. We have attachment points to allow us to hold all of our soft tissue inside. They allow us to grow and change our size, especially through childhood and adolescence. You're only as big as your skeleton. You're only as tall as your skeleton allows you to be. So that allows us to create our real shape. It also gives points for our muscles to attach. Okay? We have all of our skeletal muscles attached to bones and move bones around their joints. Okay? So that's how we do everything, is our muscles are pulling on our skeleton, pulling on our bones, and our bones are moving, which allows us to do all of the intricate movements that we perform every day. And even those what we call basic movements like locomotion, like walking around. Okay? Walking around comes from moving, contracting muscles that move bones, that support our torso, support our head, support our upper extremities, and allow us to move through space and go different places. Okay? So it's pretty amazing if you think all the way back down to it's just a bunch of bones. Okay? We're just moving a bunch of bones. Um, and those bones also hold on to minerals for us, especially calcium. Calcium is stored within our bones. Calcium is used from everything from functions within our nervous system all the way to muscle contraction. So we have to have it, and our bones give us a place to store it. And they also produce red blood cells, okay, especially in our long bones, especially like our femur. We produce red blood cells within these bones. Okay, so we have more physiological functions than just giving us some structure and some support and giving us these attachment points and protection. But we also have some physiological aspects about our bones also, because our bones are living tissue. They're not just rods that are within our body. They have their own physiological functions, and they have their own blood supply, their own nervous system innervations. Okay? They're more than just pieces of structure. Okay? And they have to be able to support us, and they have to respond to different stresses, especially forces. So our bones are mechanically loaded when we stand, when we sit, when we move, when we contract our muscles, and how often and how frequently is going to affect the shape and the function of these bones, or affect their structure, their geometry, how our muscles are functioning, and our age all play a role in how our skeleton changes, and how these bones adapt to the world around them. Because our bones do adapt just like our muscles, just like our heart, just like our lungs, just like our vascular system. Everything adapts to stresses. Bone is not different. Okay, so in our skeleton, we have about 206 bones. 80 of them are axial bones. So if we look back, axial is our trunk, our skull, our midsection. Okay, so think ribs, vertebrae, skull, and then our appendicular skeleton is our extremities. Okay, so think arms, legs, hands, feet, upper arm, lower arm. Sometimes there are some slight differences within this total number of bones, but on average, most people, textbook-wise, you're at 206 bones. And there are all different types of bones. Okay, we have long bones, which are most frequently in our extremities, short bones, which are in more articulating surfaces like wrists, ankles, feet. We have flat bones, like our ribs or scapula, that are more protective based bones. Irregular bones, like our maxilla or ischium or our pubis, like a part of our pelvic bones, are axial bones, like our vertebrae, are irregular bones, because they're all in kind of these different shapes depending on their function. Then we also have sesamoid bones like our patella or our kneecap, which allows us to create greater torques around joints. Some people also have a sesamoid bone in their foot to allow greater torque around the big toe. But long bones are long cylindrical, and by long I mean they are short at one end and they're long through the middle, or they're mid-shaft. These are predominantly our extremity-based bones. So think about these as even our phalanges, even our distal phalanx, the smallest individual pinky, even on our toe, those are still long bones. Okay, they're still categorized as long bones. So your fifth distal phalanx on your foot, so your pinky toe, the end of your foot, it's still a long bone. Also our femur, our tibia, our fibula, our humerus, our radius, our ulna, our metacarpals, our metatarsals, these are all long bones. They are there for movement and reach and move and interact with the environment. Okay, we have short bones, which are often cube-shaped. They're more like solid bones. They create greater articulating surfaces. So those bones in your wrist, okay, that allow us to have all of this, it creates a larger surface area for articulation. These happen within our wrist. They often happen on our talus and our midfoot and our rear foot. Okay, our cuboid, our navicular, our talus, these are all short bones. They create large articulating surfaces that slide and glide and can absorb forces better than one individual bone. We also have flat bones. Okay, think of like our sternum, our scapula, our ribs. These are protection-based bones. And we also have large tendinous attachments that pull along. Especially at our scapula, we have attachment points throughout to allow us to create pull and movement. Okay. For our irregular bones, they often have irregular shapes, okay, like our vertebrae or the bones like our sphenoid, which is in our skull, based on their function. Most of the time they have very irregular shapes because they have large bony attachments for muscles, or they have to be shaped away for protection, like in our ischium and our pubis, or for us to move our jaw. Our maxilla has to be shaped in this double L position so that we can open and close our jaw. Our vertebrae have to be shaped with a large portion where we can create compressive loading, as well as different joints so that we can articulate those bones together and keep that position, as well as large protrusions for muscular attachments. So it's all based on that bone's function, why we are using that bone, and it will be shaped to best allow that. Okay, the last type of bone we'll talk about is a sesamoid bone. Okay, this is our major example is the patella, okay, which is our kneecap, this kind of triangular bone that articulates with the femur, and our patellar tendon, or the tendon that comes from our quadriceps. It attaches to the patella, and then we have our patellar ligament that goes and attaches to our tibia, and this creates a larger kind of angle, kind of like a pulley around our knee, so that we can have greater strength or greater torque production at the knee joint. We'll talk later about that in our biomechanics sections. When we're looking at those long bones, the shaft is called the diaphysis. Okay, this is the large shaft portion. The cortex is the dense, compact bone that gives us that major structure. And the periosteum is this outer coating, this outer membrane of the diaphysis that is where our blood supply and where our nerves come in to those bones. Okay, the endosteum is the membrane that lines the inside of the cortex. Okay, this is within the cortex, and the medullary or the marrow cavity is where we create bone marrow. We also have yellow marrow through the middle. Most of the thickness and the shape of our bone is around the outside, and the inside is more for physiological functions within those long bones. So blood supply, creating red blood cells, but we store those minerals and store that structure around the outside. So it's kind of like this cylindrical tube rather than one solid piece. Okay. The epiphysis is the ending of the long bones, and it's often this kind of spongy or trabecular bone. And the epiphyseal plate is at the very end of the epiphysis, Okay, and this is where we create growth during childhood and adolescence. This is the piece where we begin to calcify and extend the length of that long bone. So we need this to increase our height. We have to have that activity at the epiphyseal plate that allows those bones to expand based on our genetic predetermined size of those bones. If we have an injury to the epiphyseal plate, that's where we see issues with stunting growth within a limb, within a bone, which can cause problems down the road if there's an injury earlier in life. But all bones start from a cartilage, okay, from hyaline cartilage or articular cartilage during embryo. And then as that human develops, that bone begins to change and begins to calcify, so it becomes actually harder bone and actually physiological bone. So we're getting everything from the inside, like our medullary cavity. We're building up an epiphyseal plate, building in spongy bone, okay, which gives that absorption near the joints. We're building articular cartilage as those bones start to innervate or start to articulate with each other. And then we continue to grow throughout childhood and adolescence. And that growth comes from the bone. Okay. Bone grows from the activity of osteoblasts, or cells that create new bone. Osteoclasts are cells that resorb old bone. So break down that old bone, take those minerals out. Maybe we need to use them for something else. Maybe we just need to create more bone. But we have active cells within the bone that create new bone and resorb old bone, or increase density, decrease density. Okay. Our bones are primarily minerals, primarily calcium carbonate, calcium phosphate, and then about 25 to 30% water. Okay. There's also collagen mixed in there to create some structure. And as you age, if we lose collagen, we begin to create more brittle bone. Okay, we can go through each individual piece, but this cancellous bone is our spongy bone, which is our kind of our absorption bone. We see this closer to the joints, especially at the femur, because that's where we need to be able to absorb a little bit more force and allow a little bit more strain. The cortical bone is the stiffer bone, which is most often in the center, in the diaphysis of that bone, to allow us to resist greater stresses and support more weight or support against those forces that are acting on our body. And then bones begin to change, okay, or they are adapting based on the direction and the magnitude that we apply forces to them. This could be from forces from the world, okay, maybe this is like gravity, or it could be forces from our muscles contracting and pulling on those bones to create, and that will create more bone around those attachment sites. Okay. Osteogenesis is the creation of new bone from osteoblasts. So it's osteogenesis. Osteoblast activity causes osteogenesis. Once that osteogenesis has stopped, or we've stopped creating more bone, those osteoblasts become osteocytes, which hold on and maintain that bone structure. Okay, when we no longer need, or we're no longer stressing the bone enough to require additional minerals, osteoclasts will absorb or demineralize that bone and also dissolve the collagen that is creating that mineral structure. So if you don't load your bones, you lose your bones. If you load your bones, you will build better, stronger, more resilient bones. Okay, and that's called bone modeling, is osteoblast activity. Bone remodeling happens after osteoclast activity or during osteoclast activity to remodel it to a lesser bone, or we remodel it to more bone. So we grow bone, and then we're continually taking bone away and adding bone depending on the stresses that are applied. Okay. Each of those individual protrusions or changes within the bone, that those identifiable markings are called landmarks. We're going to use them because they tell us where we are on the bone, and it's often a muscle attachment point or a connective tissue attachment point. Okay. A condyle is an articulating surface. Okay, we have them here. We have facets here, which is protrusions that are then articulating with another surface, or the head, which is another articulating surface depending on the bone structure. Okay, so this is an example of the femoral head. We also have different processes for ligaments and tendon attachments. So like crests, epicondyles, lines, tubercles, tuberosities, spines. These are all points where we're going to have greater attachment sites, and they're often protrusions that stick off, or they're called processes. Okay, and bones develop to resist stress. Okay, so they create more surface area to have more ultimate strength, especially if they're continually stressed. Okay, the distribution of that stress, or the distribution of the bone, is further away from the center to create a larger polar moment of inertia, which creates a greater resistance to bending and breaking and twisting and turning. Okay, so that polar moment of inertia gives us a greater resistance against torsional and shear stresses. So we can have the same amount of bone mass, but by expanding it out, we can create a larger bone with less total bone mass. Okay, so if we had a kind of a dense bone throughout the entire center, we would have too much bone mass, we would have too heavy of bones. They would be very strong, but they would be very heavy. So this creates light bones that are also strong against other stresses. Okay, we want a larger polar moment of inertia so that we can resist other forces. Okay, those forces that are acting on the bone are compression, tension, shear, bending, and rotation, or torsion. Our bones are very strong against compression. They're okay against tension, but they're weak against shear, which happens during torsion or kind of compression, bending, turning, tipping, things like that. Okay. With compression, this is a squeezing force or a squishing force. This acts along the long axis. This is what our bones are really good at resisting. Okay, think about when you stand upright or you sit upright, everything is going straight down and compressing those bones. Those bones are very strong against that. Okay, with tension, we have some good strength there. Our muscles and our tendons pull along. Our tendons and our ligaments pull those bones and create tension. So we're strong against this, but not as strong compared to compression, because we're constantly feeling these compressive forces. Our bones adapt to fight off these compressive forces. Shear forces are opposite directional sliding forces. So think of them like it's a scissor motion, so there's slicing across each other. Our bones are very weak against this type of force. Think about fractures where you plant and then someone hit your leg and it sliced your bone. Okay, or you're kind of pulling and they're moving the bone and sliding it away from each other. This happens during other activities like bending, here's an example of 3-point bending, where we have forces on either end and a force in the middle. Think about snapping a wooden pencil. Similar sense here. We have this compression point here where the pieces are coming closer together and being compressed. We also have this tension force that's on the other side that's pulling the bone away from each other, which creates a shear force down the center, which then ends up fracturing the bone. Cantilever bending, okay, this happens at our femur, where we have tension at one side and compression at the other. But with bones like our femur, our bones are created to resist this type of stress. Okay, we have our spongy bone here. We also have a lot of bone mass available to resist that tension and that compression. Okay, we also have muscles that resist bending. Okay, so every time you stand, or every time you take a step, your tibia slightly bends, but your calf musculature contracts to resist that bending. This is a broad example, but we have muscles to resist those forces also. Because muscles can actively resist force, bones can only passively resist force. Okay, torsion is a twisting force. So we're twisting in opposite directions. Okay, think about like wringing out a towel. this creates a shear force through the center. But if we have a larger polar moment of inertia, or a larger radius, more of that mass is outside, we're more resistant to that spinning force or that torsion force. So that's why having larger bones is beneficial, because now we're able to resist that. But it does cause some compression and some tension throughout the center and some shear forces through the middle, which can lead to fracture. Okay, because we are very weak against that shear force or that sliding force, as part of the bone is twisting one way, part is twisting the other. Okay, that shear force is felt through the center of the bone. So, quick recap, bone strength comes from its weight, or bone strength. Bones are very strong relative to their weight, okay, because they have that large polar moment of inertia and more of that bone is outside away from the center. We have very strong bones that are also very light. The surface area of the bone will give us our idea of how resistant we are to forces. So larger bones, more surface area, more resistant to forces. Bones grow based on your genetics, your hormone production, which gives us the height, gives us the size. And then if we're building up different pieces of the bone or densities in the bone, that comes from Wolff's law, which tells us that our bones adapt directly to the stresses that are applied to it. And then remember our other purposes like red blood cell production, mineral storage, some of those other physiological purposes. We also have our different types of bones. Remember long bones, short bones, flat bones, irregular and sesamoid bones. Some examples here throughout our body. Long bones for movement, short bones for articulation, flat bones for protection, irregular bones based on different functions, often for muscle attachments, and sesamoid bones for protecting the tendons and creating more torque. Also review here, we have collagen and mineral for the dry weight. Okay, this is kind of the hard weight, the non-water weight. So collagen gives us some tensile strength and flexibility. The minerals give us that rigid structure to hold us all together. And then we do have water within the composition of the cells of the bones. Most of bone structure comes from the calcium and collagen. So collagen gives us that tensile strength and it gives us that structure. And then the calcium gives us that hard, rigid surface. Remember, we have compact bone. This is the dense outer portion, that strong bone that's resistant to those forces. We have the spongy bone, which is porous. This is our shock absorption points of the bone, where the trabeculae are available. So this is kind of a spongy-ish look that gives us some strong structure and resistant to those compressive forces. Remember, our periosteum is where our nerves are and where our blood supply comes in. This is the outer surface of those long bones. And we also have tendon attachments along the periosteum. And the epiphyseal plates are here at the end of the diaphysis, just before the articulating surfaces in the spongy bone. Okay, so this gives us that growth of the long bone. Other review, that Wolff's law, okay, bone is gained and lost depending on the stress. So more stress, more bone, less stress, less bone. And it depends on the rate, the magnitude, the location of that loading or of that force application. Okay, so this could be affected by your physical activity levels, what types of activities you do, if you're loading bones, not loading bones, if you have different compensation patterns, you're going to stress bones in different ways. Okay, and that bone is going to either create more bone through osteoblast activity, maintain bone. If it's just this similar loading, we don't need more, we'll turn them into osteocytes. If we need to dissolve that bone, we need to get those minerals out, we'll use osteoclasts, and that will model and continually remodel our bone based on how we're applying stresses. Okay, but there are some general changes, like osteopenia and osteoporosis, which is a loss of bone mineral density. This happens from hormonal changes. This often happens from age and physical inactivity. But these are the loss of bone mineral density and the severe loss of bone mineral density, which puts you at a very high risk for fracture. Okay, so this is something to pay attention to as people age. We want to make sure that we are continuing to load the bones and continuing to have a high quality diet so we're not pulling that mineral out of our bone. Okay. Last one, we have our different landmarks, things like trochanters, tuberosities, spines. These are points, these are protrusions along the bone. Depending on the bone, depending on what it needs, it will have some or all or a few of these different types of processes, or it'll have some cavities and depressions like foramen or facets or grooves or fossa, where something may articulate. We might have somewhere where something like an artery or a nerve is going to go through. So these are points, locations along the bone where we have specific functions that need to be achieved. All right, that's going to be the first section, part one of our osteology, looking at just the bone review. We'll have another one on loading review and another one on tendon and ligament review. All right, thank you very much.